My name is Ernest Lamoth. I'm a reporter for the Southland Journal.
My name is Brenda Battle. I'm the Senior Vice President for Community Health Transformation and Chief Diversity, Equity, and Inclusion Officer for University of Chicago Medicine.
Well, Brenda, thank you very much for joining us today. I know you have exciting news. So can you talk a little bit about the overall project that maybe people haven't heard of?
Sure. First of all, thank you for this opportunity to join you to talk about the project. The University of Chicago Medicine is planning to stand up a cancer center on the south side of Chicago to address the healthcare needs around cancer, to address healthcare disparities, and to provide access to cancer care for the Southside community and the global community in one location where we can conduct cancer therapies, hospitalizations, cancer research, cancer education, and screenings in this location. So what's super exciting is that this is a major investment for the Southside, one of the single largest investments that have ever been made in healthcare for the Southside or in the Southside. And it's just super exciting to be a part of this endeavor, and it's much needed for our community.
And can you talk a little bit about why you believe it's so needed in the community, especially in the South Side of Chicago?
Yeah, because cancer is the second largest cause of death on the South Side. And the South Side suffers from a number of disparities, cancer disparities, as well as other disparities in chronic conditions and lack of access to resources and disenfranchisement. You name it, the South Side suffers from it. So to have access to this type of care in our community is really important. Right now, nearly 60% of the people leave the South Side for cancer care because there's just not enough access to it. And we want our Southside community to be able to access the level of care, comprehensive cancer care in their community, as opposed to having to leave the Southside. And we know that there's an anticipation of greater cancer disparities since the pandemic. People have been delaying care, delaying screenings, for a number of reasons. And the result of that is going to be that we're going to see increases in the rates of cancer. And so the community needs to have access to these services on the South Side where they live so that we can address those issues. And I just think having this hospital on the South Side will minimize individuals' reluctance to access care when they need it.
And you mentioned the pandemic, Brenda. Can you talk a little bit, because obviously being healthcare, you've been the front line of that issue. So you talk a little bit how the last 2 years has treated you when it comes to healthcare and the pandemic.
Well, the pandemic's been rough for everybody. It's been rough in our communities. When you look at the rate of people who have been really sick or died from the pandemic, it's been people in our communities, Black and Brown communities, that have suffered the worst. And naturally, they've suffered the worst because they already have a high rate of disparities, and you pile the pandemic on top of a high rate of diabetes and heart disease and any other type of chronic condition that our community faces, then you're going to have even a greater devastation to the community. We also have, a history of, distrust of the healthcare system. So there was a slow uptake in persons in Black and Brown communities getting access to the vaccine. And we've seen better numbers, but we still see in our communities lower numbers of vaccine rates than white communities. So the pandemic has had an incredible impact on the community, and it's also had an incredible impact on healthcare workers that are taking care of individuals in communities. It's impacted just the morale and the resilience of the healthcare worker that is continuing to be present and taking care of individuals that are in the hospitals because of COVID-related conditions. This is a group of healthcare workers. They want to take care of the population, but I'd say that I think we're seeing it all over the country. There's a high rate of burnout and a weakening of the level of resilience for these group of individuals. So the devastation is, across all kinds of workers. We know that. But the healthcare worker is a little unique in that they're taking care of the sick. And so it's the caretaker taking care of individuals that need that help. And so we're seeing a pretty severe impact on healthcare workers as well.
And can you talk about the importance of diversity, equity, and inclusion?
Well, it's very clear, particularly in our community. In our community, 77% of the individuals that live in our community are either Black or brown. And so the diversity and equity and inclusion is critical to be able to serve our community. One, from a representation standpoint, we need to represent the people that we're taking care of. We need to understand some of that generic underlying, issues and knowledge and experience and history of individuals that we're taking care of. And so diversity is important, inclusion obviously is, but what we're trying to get to is equity, creating a level playing field for individuals around healthcare and access to healthcare and knowledge. And so you can't really effectively care for and serve a community, particularly like ours, without a very intentional focus on diversity and inclusion and equity. It's impossible.
Is there anything else in general you'd like to add that maybe I didn't ask?
I just like to say that, as healthcare workers, we're committed to being present to take care of individuals who need our help. We chose this field because we want to take care of people, and we will continue to do that. But I would also like the community to take care of themselves, take advantage of, the systems that help them to have better health and wellness. So I'm a nurse myself. So I like to say to people, get the vaccine, take care of your families, get your kids vaccinated. I'd like for them to hear that as we're taking care of you, take care of yourselves as well.
Okay. And following that with one last question, because my mom was a nurse as well too, and I've always practiced taking care of yourself, and early detection saves lives. Can you talk a little bit just about that phrase and how important it really is?
Absolutely. We always want to be on the side of prevention as opposed to being on the side of, having to address acute or chronic illness. And prevention saves lives because it allows us to leverage our own empowerment. That's how we take care of it. We're empowered when we practice prevention. And so as a nurse, like your mom, we want people to be able to be involved in their healthcare and their wellness. And one way to do that is through prevention. So I'm with your mom. Prevention saves lives. So let's do our part, and let's do it because we can own that and we can control that. And let's do what we can control. And then as nurses and doctors, we'll take care of that you can't, but do what you can to. That's my disposition on that.
Well, thank you once again for joining us today.
My pleasure. Thank you so much. And it's great to meet you.
Great to meet you too.